Hi, I'm Dr. Elizabeth Claydon. I'm an assistant professor in the School of Public Health and Social and Behavioral Sciences. And I just wanted to talk to you a little bit about my experience with the ACE mini grant and my experience with our service learning partner, Pantry Plus More, and how that worked with our students for a couple semesters. All right. All right, so our project was called How Do I Cook That? A class community partnership to create a recipe book for youth served by Pantry Plus More. And our service learning partner was Dr. Mike Miller with Pantry Plus More. And we started to build this collaboration back in the summer of 2019 to really think about how we could build this partnership even before our service learning class started in fall of 2019. And so we had several meetings for an informal needs assessment to really find out what Pantry Plus More's needs were so that we can match those needs with the expectations for learning for the students for the semester. And so then we had our fall 2019 service learning class, which is Pub H 352. And we had decided in the summer that the main goals for the students that semester would be to look at the ingredients in Pantry Plus More's pantry and to find and to create recipes based on those ingredients that would be easy for youth or children to make at home, especially for when their parents might be working a second job or might be unavailable, and so that the children or youth could still have nutritious and easy recipes for them to make. And so the students actually created recipes, a couple of recipes, as well as some YouTube videos that semester to really help illustrate those recipes easier for for children to make. We really wanted to move the partnership forward, and we had a lot of ideas of things that we wanted to do and continue to work with Pantry Plus More. And so we heard about the ACE mini grant and thought that that was the perfect opportunity to really continue to bridge this service learning connection between class and community. And that experience for applying to the mini grant was really seamless. We worked on compiling information. Dr. Miller, from his expertise with Pantry Plus More, understanding what ingredients they had, what was feasible based on his experiences there, and then myself understanding sort of what was needed for a grant and some of the literature behind food insecurity, and really developing a plan together and working on the grant pretty seamlessly together to get that submitted in time. I found the process really easy and a really good connection and good builder between Pantry Plus More and I. And so we developed the plan for really a recipe book creation and to try to develop recipe books based on our idea in the fall 2019 semester of creating some of these recipes. And so to expand on that and to create recipe books that could be given to the population, as well as have PDF for sustainability, but also have recipe books that could be given out so that people could take them home, use them, and then provide feedback in terms of questionnaires so that Pantry Plus More could have some understanding of what recipes worked well, what people enjoyed about the cookbook, and what their needs were related to recipe and cookbook. And so our spring 2020 Pub H 352 students, after we received the mini grant, were tasked to develop recipes for inclusion. And so some of their goals were thinking about the breadth of recipes, so thinking about having enough breakfast, lunch, dinner, snack, dessert recipes, and having some equal proportions of those. Thinking also about the readability of recipes, health literacy and literacy of recipes and of information in general is an issue when we're thinking about public health. and public health promotion. And so that was a really interesting piece for our students to think about. And then also ease of making recipes for children. And so thinking about, different target populations for our public health students was very useful for them to have that experience, tailoring it to different populations, as well as really useful for Pantry Plus More to have those recipes tailored. And so we had to pivot a little bit from our plans with COVID-19. And so the recipe books were not printed and distributed during the spring semester as planned, but they were almost completed, at least in concept form. The binders were purchased, and then printing purchases were accounted for as well. And a PDF version was created for sustainability. And the recipe books are now printed and ready to be distributed in the next few weeks. So it's really exciting to sort of see it come to fruition. This is just sort of a screenshot from the cookbook, and just, again, really rewarding to see parts of that cookbook and to see the cookbook as a whole, and all the effort and work that's gone into that, families can now use and hopefully enjoy. And so we've continued our partnership into the fall semester with Pantry Plus More, and now really working on those questionnaires, which, are part of our plan. One of those questionnaires is going to be distributed with the cookbook to determine individuals' interest in recipes and which recipes they're most interested in making. Ingredient need, so what ingredients would they need for the recipes they want to make, and are those available with Pantry Plus More, or are there other ingredients they might need? Cooking utensils needed. Do they have measuring spoons? Do they have measuring cups? Do they have pots and pans that they need? So what needs still exist versus what do they have? And then one questionnaire will be developed for use after the cookbook to develop to determine what was the ease of making recipes, what were the enjoyment of the recipes as well, and then what was the likelihood that they will make the recipes again. So it's been also very useful for the students to understand how you develop surveys, and that survey development is much more complicated than they might think at first. And so that's been, I think, really rewarding for them to see. And then also this will be very useful for Pantry Plus More to have some data points to understand sort of how they might need to change things if they want to add recipes in future. Do they need to add more recipes that might be vegetarian, or do they need to have recipes that tailor to different dietary needs? Do they need to think about providing individuals with measuring spoons, because people might not have enough measuring spoons at home. So it just provides that data so that if there's problems with people being able to complete the recipes, then we know why. And that's a really important part of doing public health and public health promotion, is to understand, what needs still exist and how we can work to fill those. Please let me know if you have any questions. Just overall, this was a wonderful experience to have the mini grant. And then I think it's just really helpful to have this, especially if you have a partner that you've worked with for some time and you really want to continue to move the partnership forward and have ideas that you want to work on together. I think it's a really rewarding process, both for class, for students, and for the service learning partners. Please contact me if you have any questions. I'm more than happy to answer. Thank you again so much.